Hello, my name is Khade, and I will be discussing the results of a multi-site study comparing the effects of movement and seated play interventions on repetitive behaviors for children diagnosed with autism spectrum disorder, delivered in a face-to-face method versus a virtual telehealth method. One of the core diagnostic impairments in children with ASD includes heightened frequencies of repetitive and maladaptive behaviors. For our study, 45 children with a confirmed diagnosis of ASD, aged 5 to 14 years, were randomly assigned to one of three intervention groups: creative movement, general movement, or seated play. Sessions were 1 to 1.5 hours long and were conducted with the child twice a week, over 8 weeks, primarily by an expert clinician, and were delivered either face to face or via telehealth. We coded videos of early and late sessions for three types of repetitive behaviors: sensory, stereotyped, and maladaptive. Frequencies for standard time were calculated for repetitive behaviors across early and late sessions. Data from a subset of 39 children suggests that there was a statistically significant reduction in total repetitive behaviors from an early to a late session in the creative movement group, but not in the general movement or seated play groups. Moreover, a reduction in total repetitive behaviors from early to late sessions was seen in children both face-to-face and via telehealth, with mean change scores in repetitive behaviors showing a statistically insignificant difference between the two intervention modalities. Further analysis of repetitive behavior types suggested that the creative movement group showed a significant reduction in sensory and negative behaviors across training weeks. Similar to previous results, these improvements were comparable in children seen using face-to-face and telehealth intervention modes. In conclusion, although our sample size for this comparison is limited, preliminary data suggests that similar trends in children seen face-to-face versus via telehealth. Telehealth-based training, therefore, may be a feasible mode for clinicians to provide care to children and families with difficulties accessing in-person care for individuals with ASD.